arranged. Okay, I'd like to say thank you to SAGES for this opportunity to present today. I'm going to keep this very simple, so we're not going to go into a lot of data and reviews and such. It's going to be mostly a review of terminology and simplifying the terminology. At that, I have no disclosures. So today we're going to categorize some meshes that are available for use on the market, concentrating on the categories, not so much on the nitty-gritty details and what makes up each mesh and what the components are of each mesh per se, but to promote a system of common language for us to use as surgeons so that we're all talking about the same thing, with the ultimate goal of facilitating your mesh selection and acquisition process for your cases. Hernia repair is an ultimate challenge, in a sense. It is a continuously evolving art of choosing the best amalgam between the three worlds of physical material selection, patient selection, technique selection, et cetera. So that's why it's so challenging and also so rewarding as well. In addition to that, hernial disease occurs in vastly different anatomical environments, each with a unique profile of physio-mechanical requirements for repair, depending on location and recurrence status. Another challenge is the added obstacle that in the literature, several terms can sometimes mean the same thing and sometimes mean the opposite thing. These terms, bioprosthetic, biomaterial, biosynthetic, I've seen all used to refer to both synthetic polymer textiles and to biologically derived graft materials. Nothing like an element of confusion to help clear things up. So what I'm going to suggest is to not use those as your primary terms in describing these mesh implants. Use what the original source material is. So it's a synthetic or a biologic, or in the case of Xenopro, a synthetic biologic hybrid. If there ever was a moving target, hernia repair is surely one of them. Since the 1960s, when polypropylene mesh was first used by Dr. Usher, these materials have drastically changed, as well as our techniques in terms of sublay, IPOM, retrorectus, component separation techniques, just to name a few. And as the technology has advanced, our understanding of the dynamics of the abdominal wall environment has also advanced, as has our ability to produce products that we believe offer ever better biocompatibility. Our overall goals then have to be balanced with the limits of reality and helping patients to understand the sometimes complicated nature of hernia disease is a responsibility that remains with us. Getting their buy-in is sometimes an obstacle because patients commonly hear about hernias and some that are very simple and straightforward, but my bias personally, and I'm not sure about you, but I think a lot of people think that hernia disease is a fairly simple disease. And so the responsibility to educate them, if it is a more complicated case, relies solely with us. A couple of clinical tools that I have found personally very useful out of the Carolinas group is the CEDAR app, as well as the CEQOL app. And this is something that you can show to your patients. You can modify their risk factors, and they can see right in front of their eyes if they modify their own risk factors and do a bit of what's now called prehabilitation in terms of modifying their own risk factors, how they can impact and improve and therefore participate and therefore bear some responsibility in terms of their outcomes. I think this is really the only way we're going to get at the truth. We live in such a time of online consumerism, and I do think that people sort of view surgical care and medical care in a similar way. If they're not happy with one practice or one individual, they'll just go right to the next person. So today we're going to concentrate on biologic mesh and synthetic mesh, those two main categories. Biologic meshes basically can come in two flavors, so to speak. One is a cross-linked form and one is non-cross-linked. And then you have to consider the source tissue, be it an animal source tissue or a human-derived tissue. Biologic mesh is basically tissue that is processed so that it's devoid of any immunogenic moieties or anything that would cause rejection, per se, of the matrix material. It leaves behind just the scaffold, if you will, for new cell ingrowth and revascularization and ingrowth of tissue. But cross-linking is a way to increase the material stability and durability of the material and was first used in prosthetic heart valves from porcine source and has played some role in providing a little bit more mechanical durability over time in vivo because it stabilizes the collagen material itself and makes it a little bit less susceptible, perhaps, to degradation over time. So that's thought to present a advantage in some of these materials. Pros and cons, we all know this already. Some things that can be, obviously there's the cost difference between the biologics versus synthetics, but some of these materials are very hard to determine from the manufacturers. What exactly sort of processing do they undergo, and how much cross-linking does that actually represent? That's not actually very well known. And just remember that in animal studies, when you're looking at these comparative studies, a porcine dermal graft in a pig is an allograft, whereas a human-derived graft in a pig is a xenograft, but vice versa in your patient. Whether that clinically has a significance or not, we don't know at this point, but just remember that point when you're looking at these. In terms of the synthetic meshes, I like to call them permanent and non-permanent in terms of the materials. And if there's one slide that you take home today or take a picture of, it's this one. So these are the categories as best as I could simplify them down to some very core qualities. So of the non-permanent meshes, right now there is what I believe to be electrospun nanofiber matrix. The company wouldn't confirm that with me, but they call it a web. So this is a long-term permanent but absorbable mesh, whereas there are also textile type meshes that are woven, and we'll go over the different types of weaves and what that means in terms of trimmability and durability over time. And then of the permanent meshes, there's a what's called a microporous or a sheet-like PTFE type of mesh. Of the textile meshes, there are monofilament and multifilament meshes. We'll go into a little bit of what that means in terms of the fiber itself. Sometimes there is more than one filament or fiber in the same weave, and then there is also the added component of a permanent or non-permanent barrier for IPOM use. Okay, I'm not going to go into all the details of this, but you should be able to access the slide on the app after the meeting. So this is just a slide for you to see the non-permanent synthetics that can last anywhere from a couple months to about 3 years in terms of their in vivo lifespan. Another list of some synthetic meshes and what they are composed of. Sometimes the benefit of variety is also sort of a downside. It's very confusing sometimes to know what exactly is it, that is in that mesh. So I encourage you to, talk to your reps and really find out exactly what it is that your material is made out of. We're going to discuss things with regards to filament, weave, porosity, and anisotropy with regards to the textile meshes. The filament is the actual thread or the yarn itself that is woven as these textiles are created. And so you can see here in this electron micrograph, the monofilament is the smooth-looking fiber, similar to the monofilament suture that we're very familiar with. The multifilament sutures are a strand made up of multifilaments, and those are perhaps thought to be more prone to difficulty with bacterial clearance if they are a permanent filament. So that's just one difference that to keep in mind between the filament types. And then you have the permanent and non-permanent designations of those filaments. And these are generally the categories in terms of the weights of the thread or the filament itself that most people use when they're referring to the lightweight, mid-weight, et cetera, heavyweight meshes. So the weave now is something else to keep in mind. There is a difference in textiles with creating what's called a weft knit, which is kind of like if you were to knit a hat or a scarf. It's a single yarn system, whereas a warp knit is a multi-yarn system. Warp knits are things like tricot. Many of the basic fabrics that are used in textile industry today are warp knitted. And then woven is your typical patterns such as you see here on the graph. The difference between these two is that the warp knit, because it's a multi-yarn system, is more amenable to being trimmed and sized as you need it, whereas the weft and the woven knits can tend to fray at the edges where they're trimmed. So, for example, if you take a pair of jeans and make cutoffs, that edge tends to fray. The non-warp knit materials tend to fray at the edges, so they're not considered as trimmable as a warp knit material. Then there's also the non-woven materials. This is a picture of the BioA that are created with a process called electrospinning, and this creates a very, very small thread of material coming out, which is electronically attracted to a plate, and as this is rotated around, it collects on that plate, and then you have your matrix. Porosity is another thing to consider in terms of the ingrowth of the cells and tissues that need to repopulate into your matrix mesh. And here's just a picture so that you can see visually some of the differences between the large pore, medium pore, small pore meshes and what they look like. So now isotropy. Anisotropy is a component that is the physical sort of stretch, if you will, of the mesh. If you take a piece of mesh and physically stretch it one way and stretch it in the other axis, does it stretch equally in both directions, or is there an inequality of that? That's important to know because the abdominal wall stretches more, obviously, in the horizontal direction with respirations and a bit less in the vertical direction. So it's recommended to match the, if you're dealing with an anisotropic mesh that stretches differently in one way versus the other, to have a greater stretch on the lateral component versus the vertical component. When dictating, just name as many characteristics as you can, just to be clear. And what I do, I didn't have a picture of one of my product cards, but I actually stick the stickers on the back of my business card. Chances are they might lose it. I do give it to them in their follow-up visit, so that perhaps someday, if they were to end up on somebody else's doorstep, perhaps that might help somebody else. And just my recommendations, give yourself lots of time, make some phone calls, make sure that you get the appropriate mesh for what you actually need. And you can contact me at the Gmail address if you like. Thank you.